Welcome, everybody. On behalf of the Vancity Office of Community Engagement and the Cultural Programs Unit here at SFU Woodwards, welcome to the beautiful Javed Mofagian Cinema. Tonight we'll be kicking off our discussion series in partnership with Pivot Legal Society with the discussion on health, harm reduction, and the law. Obviously, Insite was being discussed at the Supreme Court last week, and it's been a long journey in terms of the debate around harm reduction. I know that when, on a personal note, when I was finishing off university in the mid to late 90s, a number of people on the panel tonight, I met them at the time, people like Bud Osborn. I remember going to a heroin overdose conference with Liz Evans, and it's really great to be here in a university setting to be part of the kind of discussions that need to happen in the city, and we hope that SFU in the coming years in this space we will continue to do that. Also just wanted to recognize our sponsors beyond Pivot. We've relied on the help of a lot of volunteers and a lot of organizations, including the Urban Health Research Institute, CDPC, British Columbia Center for Excellence in HIV/AIDS, PHS Community Services Society, the BC Civil Liberties Association, and Megaphone magazine. I'm just going to pass it on to Darcy Bennett from Pivot.
Hi, thanks so much, Am. Having worked with Pivot since 2006, I've sat in on a lot of discussions about Insite and the whole legal battle to keep Insite open. But as we started talking about Insite going before the Supreme Court, I realized there was still a lot about this case that I didn't understand. And it was kind of out of my ignorance that the impetus for this event sort of started milling around. As we started organizing, I was a bit relieved to know that I wasn't the only one who had some of these questions about what this case was all about and what it might mean for Insite, what it might mean for other supervised injection facilities, and what it might actually mean for drug policy in Canada. Tonight, I think we're going to get some answers to those questions, but I think maybe even more importantly, we're going to hear about the journey of some of the people whose tireless work have made Insite the reality that it is today. But before we get started, I just wanted to introduce our moderator for this evening. Donald MacPherson is a tireless advocate for evidence-based drug policy. He is the author of Vancouver's innovative 4-pillar drug strategy. He's also the director of the Canadian Drug Policy Coalition, as well as being the vice chair of Pivot's board, where he is an unending source of mentorship and support. So I'm going to hand it over to you.
Thank you very much, Am and Darcy. Before we get going, I'd like us all to recognize and acknowledge that this meeting is taking place on the unceded territory of the Coast Salish people. And it's very special that we're here tonight. These gatherings are always bittersweet for those people who aren't here tonight, who have suffered from debilitating diseases. Some have died of overdose deaths, etc. That we have to keep remembering and keep struggling so that we can implement services that truly are life-saving services. We thought we have a lineup which I'll explain to you in a minute, but we'd like to start the evening with one of the people who's been instrumental in the sort of struggle for harm reduction and improved access to health services in Vancouver, in BC, and in the country, an artist, a poet, Bud Osborn. And I'd like Bud to read a couple of poems just to start us off. And within the poems is sort of the essence of what this whole issue is all about. So, Bud, could you come up and... I'm going to say a couple of words about Bud. He's one of the main reasons I'm here doing this work. He's an inspirational character and person in the downtown east side, a widely published poet, a committed downtown east side resident and activist, a tireless advocate for people who use drugs, and one of our most articulate and powerful voices in opposition to the war on drugs that has been raging globally for over a century now. Bud?
Thank you, Donald, and It's very inspiring that we are all here tonight, and it's very gratifying and moving to me. It's a very passionate issue to me, as I'm sure it is to all of us who are here. The two poems I'm going to read, or was asked to read, actually, the first one is a kind of sketch of the history of the battle for Insite and the struggle for it. The fight for Insite began in a political, rhetorical atmosphere of depraved indifference regarding overdose deaths and pandemic emergency. Horrifying ghosts of human beings calling radio talk shows and actually telling me, why don't they just string barbed wire around the downtown east side and let them infect each other to death? Or, the only good junkie is a dead junkie. I remember one welfare week, 14 years ago. Sirens screamed, lights flashed red and white all day, all night. One hot afternoon that same week, I met a friend of mine on the corner of Cordova and Main. She's a First Nations woman and activist who told me when I asked how she was that her family was gathering to make another crucial decision. Her cousin had fixed a loan Wednesday evening in an SRO room, and when her husband returned, found her dead on the floor. He made a noose with a long piece of cloth, hanged himself, and soon was dead. And because the couple had an infant son, the family was gathering to determine the best disposition for the suddenly orphaned child. And this entire unjust and tragic situation might well never have happened if Insite was open. But as my friend and I were saying goodbye, a flame burst inside me, fueled by grief and rage, like a spontaneous, fierce combustion flashing up through my nervous system and roared in my head like a psychic explosion. Because of another, because of too many, because of an unnecessary overdose death. Yelled two words repetitively in my head: no more, no more, no more. Of this heartbreaking, family-shattering, community-diminishing pain of overdose deaths. I immediately ran, literally, from that conversation to see Mark Townsend and Liz Evans at the Old Portland Hotel, and with Dave Dewart, Ann Livingston, and several others planned a day of action. We pounded 1,000 crosses into Oppenheimer Park, blocked Main and Hastings with a heavy chain, and distributed statistics of misery to commuters unable to get to work. 1,000 crosses memorializing just 3 years of overdose deaths. A cross is a symbol of political execution. A cross is a symbol for social revolution. And from that afternoon, the battle to save lives was declared. The battle to save the lives of those so many others wanted to die. And from that afternoon to Insite's opening, we've never ceased in our efforts to save lives and bring peace, because everyone suffers when compassion is ignored. Grateful when I came here, I was told that this is a kind of a celebratory occasion, and this next poem I was very honored to be asked to write a poem for the opening of Insite. We of the downtown east side have made history today. We have had the highest rate of overdose deaths in the world. We today are making history. We have had the highest AIDS rate in the world among injecting users, the highest rate of tuberculosis from shooting up in putrid alleys and poisonous hotel rooms are making history. We have won a major battle. We, the most afflicted of the poor, have won a battle. In the war against the drug warriors, the U.S. State Department, the DEA, the RCMP, we have beaten them in a harm reduction battle, a war of at least 50 years begun by Ernie Winch, MLA for Burnaby, who first tried to bring safe injection sites to Vancouver, and the RCMP shut him down. 50 years, tens of thousands of needles, deaths and disease, tens of thousands of destroyed families and hopelessness. But here something new has emerged from the troubles, work, sweat, demonstrations, tribulations for ever so many years from so many people. We are writing a new Canadian history despite death-dealing opposition from Ottawa. But this is Canada's real identity, not tearing apart communities and families. We have fought for over 50 years, and today we can announce an incredible victory, saving lives and giving those lives opportunity for change, for a real life of love and joy, of care and health. This is Canada. This is what a supervised injection site is about. This is our day, the day for everyone who has ever cared for the downtown east side. In a world of death and terror, we have won a corner of it for life and peace. There has never before been in North America a supervised injection site approved by 3 levels of government and the police until now. So embrace and congratulate each other. This is the beginning of new life for each of us. This is a new illuminating light for everyone in the blackness of the war on drugs in North America. A new illuminating light of hope. Each day, Insight is open. Thank you for listening.
Thank you very much, Bud. Tonight's about the past and it's about the future. This event is like a punctuation mark on a much longer story that will play out as we go forward in history, as we try to attain the highest achievable standard of health for all Canadians, including those who use drugs, and to change our drug policies to reflect an approach that promotes health, safety, human rights, and social justice. As the evening unfolds, we will hear from 7 speakers. Bud will be back to tell a little bit about his experience, who will do their absolute best to keep to 8 minutes. And someone's got a sign down there that has a 1-minute warning and a 30-second warning or something like that. And they all have to, we've asked them to give their reflections on where we have come from and where we may be heading in the future and the challenges that we may face. We will see 4 short clips of the Supreme Court hearing that took place last week that illustrate portions of the legal arguments made by the federal government, the PHS Community Service Society, and VANDU. And we'll take questions, we'll take written questions. We have 4 wonderful young high school students who, where are they? Can they put up their hand? They're right at the back, all 4 of them. Could you yell out what school are you from?
St. Thomas More.
All right. All right. So as the evening unfolds and the 7 speakers come up, I'm not going to say anything about all of them right now. I'll introduce each one of them. If you want a piece of paper and a pencil, just put up your hand and we'll write down a question, and we'll try and get as many questions done at the end. And then at the end of the speaking, we'll invite all of the speakers to come up onto the stage, and we'll have a healthy amount of time for question and answers. Our first speaker is Liz Evans. Liz is the Executive Director of the PHS Community Service Society and one of the main reasons that we are here today reflecting on the Supreme Court hearing last week. Liz is part of an amazing group of people at the PHS, an amazing PHS team that has worked so hard over the past 15 years, 18, 20, I don't know how long, Liz, it's been a long time, to bring about a change in the way society views peoples on the margins, those with addictions and mental health, and those with addictions and mental health issues. Liz has traveled the country advocating for change in our drug policies and health systems. She has been an inspiration for many people from around the world who come to visit the PHS and the many programs that the PHS operates. So please give a hand to Liz Evans, who will...
Well, thanks everyone for coming tonight. I think the fact that there's so many people here points to the fact that Insite actually does matter. And it matters because what we do as a country around drug policy matters to all of us. But in my opinion, it's not that Insite is strictly a policy issue, nor is it really a legal issue, nor is it really a health issue. I believe that this is an issue of us coming to terms with our collective humanity. We all suffer from being human, whether we're shy or loud, whether we're smokers, whether we're terrified of intimacy, whether we suffer from low self-esteem or we struggle to find a place in the world by defining ourselves as being someone other than someone else, or as a success, whatever that means. We're all under this curse of limitations that we are better off embracing. From my perspective, people who use substances that have deemed to be illicit to get by in their humanness, to cope with their set of struggles, should not be seen as different or blamed. They, like all of us, are part of us because we all suffer. Humanity shines when we come together around what we share in common. And what I have come to believe is we have many things in common with each other. We all need love. We all want respect. And we all deserve to be treated with dignity. Simply put, this is why the PHS has been fighting and advocating for people who have been criminalized as a result of their addictions, doing our small part in this incredibly complex social crisis. Insite is just one tiny place, a tiny speck on a vast continent, and yet it symbolizes a lot. It sends a message that if you are someone who uses drugs to get by in your life, that your life still, in fact, matters. It doesn't celebrate addiction. It respects people who live with addiction. It doesn't encourage people to gravitate to experimenting with drugs. It says that if you are living a life where your circumstances have led you to this place, your life still matters. What we have said to people as a society up until very recently is exactly the opposite. You only matter if you're clean, and if you're not, it's okay for you to get numerous infections, be estranged from your friends and family, be thrown into jail, and to die. This isn't good enough. The people, the they that we're talking about are all of us. We're part of a human family, and when one part of that family is hurting, we're all hurting. Why Insite matters is because it shines a light on the different way of moving forward collectively, by embracing each member of our society, however broken and marginalized, and seeing each of us, in each of us, goodness, value, and worth. These fights take place often in a climate of hatred and a climate of fear. Creating Insite, working together to get where we are today, has been a long battle with an incredible amount of people coming together. When the PHS, along with the two brave drug users, Shelley and Dean, first filed the court case against the federal government, it was not because we wanted to, it was because we had no option. It was a last-ditch attempt to save the site. It was clear to us then that no exemption was going to be forthcoming. The research has poured out of the site at an amazing rate, and we know it works. For the 8 years now, the benefits have been obvious to our community, and walking down Hastings Street compared to in the 90s is a really different experience. I sincerely believe that if we can humanize the rights of the people in our community, if we can have respect, each of us, for ourselves and for each other, our collective humanity can rise to the top. By embracing our flaws and our strengths, and together I still believe that we can win. Insite has become a symbol of hope across Canada because it speaks to a value of social inclusion as much as it does to policy reform. It speaks to our values as a society. We have just lost an election to a Conservative majority government who believe that they have the right to make some people's lives matter more than others. Those who are wealthy, those who don't need assistance. But for those of us who might need to be on disability, or people who don't come from families that can afford to support them, people who are gay, people who live lives that others can't or refuse to accept. And at the end of the day, for all of us, we win when we open our hearts, when we refuse to allow people to be marginalized, and we put our foot down and say that social exclusion on any level is just wrong. We need insight, because insight needs to exist for all of us. Thanks very much.
We're in a very high-tech facility. Thank you, Liz, for that. We're going to try and juxtapose what Liz said with some clips of the Supreme Court.
The point here is that in the downtown east side especially, possession is a fact of life. And we do assert that most users who are addicted, especially the profoundly addicted, who are the majority of users at Insite, are going to come into possession. They're going to possess those drugs for the purpose of injecting themselves or having somebody else do it in some cases. And the only real question is where that injection is going to occur and under what circumstances. So it's not a question of condoning a drug possession.
Does Insite take anybody who wants to come in, or do you have to be an addict?
You don't have to be an addicted person.
So it's anybody?
In theory,
and,
that's the
and
case.
It's anybody over 16?
Yes, people over 16 are permitted to use the site. There are special protocols for those that are over 16 but under 19, and there are also special protocols for pregnant women.
And first-time users?
And for first-time users as well. And as I understand the operation of this, there is an intent to dissuade the first-time user to use. Nobody wants to see a person stick a needle in his or her arm with drugs that have come off the street, the purity of which are unknown, etc. But if that person intends to do this, then the premise behind this is it's much better to do it where that person can be watched for signs of overdose, to make sure that the hygiene practices around injection are adequate, and to try and prevent the harm to the extent possible. But to go back to the original question, yes, it's not a question of to get in, you must be addicted.
That was Monique Pongracic-Speier, who will be speaking a little later on, and we'll have clips of three other lawyers. I'd like now to invite Bud back to the podium to say a few words about a part of his experience in advocating for Insite. Bud.
Thank you. I do much better when I have written out a poem than when I'm speaking spontaneously about an issue like this. But when I was involved, or first became involved, as I talked about in the first poem I read, the health minister. The health minister of BC said there would be no injection site over her dead body. The mayor of the time, he said, no way, absolutely not. And In 1997, I happened to be appointed to the health board, something the health board almost immediately rued. And it'll never happen again. It hasn't happened since a more or less junkie poet from the gutter and the downtown east side ends up in the health board. And they did put a lot of pressure and made a lot of changes because I brought up, well, what happened after the Thousand Crosses event? That raised the awareness in the lower mainland, at least, to the horrific situation for drug users in the downtown east side. And after that event, it somehow occurred to me that it needed to be broadened. This cry of suffering, this that I was seeing and hearing and experiencing every day, needed to be brought to an even louder and larger understanding. So I went to the library and I found out what the definition of a public health emergency is. And there had never before in the history of Vancouver been a public health emergency. So I made a motion, which I was bringing to a health board meeting to get a public health emergency passed. And fortunately, I had, along with others, by that time, VANDU was beginning to form, and so others were involved in helping with come to the health board meetings and help with the education about users, the downtown east side, what it is to be an addict, what a health emergency is. And so I knew I had their support, but that week, I'd been working with Libby Davies, and she said, well, watch out this week. They're going to take you aside, and they're going to work you over and try to get you off of this motion, the executives. And that's exactly what they did. And I thought, oh, they said, we want to talk to you in this side office over here. There were two. And I said, oh, this is what Libby was talking about. And when I got to the door of the health board meeting where I was bringing the motion, there were three executives flanking the doorway and blocking it, and they had their own motion, which said, crisis. Well, standing in the rain waiting for a bus is a crisis. But what was happening in downtown east side, if it wasn't at least an emergency, it was far, far more than a crisis at the time. So we managed to, what happened then, and it actually did work, began to get inquiries from the BBC, from the New York Times, all the local media again. I was in Ottawa for a poetry reading, and Alan Rock, who was the health minister then, he had heard about this situation, and he cleaned his calendar to meet with Libby Davies and I. And he thoroughly understood the situation. I was sorry actually to see him leave at that point because he was, I talked with him and his top assistant for several hours as to a strategy to come back here to try to change some of the minds of the politicians. And I met with them and it began to work. They were liberals. This was coming from liberals in Ottawa, and it seemed to mean something to them. So I kept reminding through the next year that there was an actual public health emergency going on at the health board meetings. And the health board, well, when I first went to the health board, I was told that by one of the workers that the health board is about politics, not health. And that's what I kept running into continually, was politics. You'd be a better advocate if you weren't on the board, if you were back downtown, not sitting here and all various. I ended up with my disability being dropped and all kinds of things that politics, the crudeness and cruelty that politics can bring. But by abiding with that and the development of the movement that is represented certainly here tonight, I believe that public health emergency and the awareness that came from that, the development of VANDU and the efforts of so many others at the Portland Hotel Society and elsewhere is what has brought us to the forefront of safety and health, and trying what we've done, and this is my last scattered comment, is that we've accomplished a revolution, a rebellion, a successful one. We know about what's going on in the Middle East, and to some sense what they're trying to do is what we have accomplished with the supervised injection site. It went from that place of not over my dead body, no, we can't deal with a public health emergency from the health board, to here we are. And how many lives have been saved? How many families have been reunited? How much hope and how much just faith that we can do more and need to do more has come out of all of the efforts of the people who have participated in this rebellion against the death of prohibition in this country. Thank you.
Roll them. Thank you, Bud. Here comes Joe Arvey.
We were waiting for an exemption going into that trial. The minister could have given an exemption any time and said the whole case is moot. We wouldn't have said it was moot because my clients don't want to be beholden to the minister under Section 56. But it's completely disingenuous for the minister to come to this court and say, oh, we might be granting an exemption. My second point is on whether or not this law is arbitrary. The trial judge found, as a fact, after reading and hearing a great deal of evidence, that the impugned provisions in their application to Insite are not only inconsistent with the state's interest in fostering individual and community health and preventing death and disease, but he also said the very provisions contribute to the very harm they seek to prevent. How could it be said, how could we conjure up a more arbitrary law than one that is self-defeating? My friends, as government lawyers, are wont to say in every charter case, it's all about policy, it's all about deferring to Parliament. There's a time, I don't see that there's any policy issue here. There's certainly nothing contentious that's evidence-based, and Madam Justice Rawls went through that and debunked that argument very effectively. If there's any controversy, it's one of Canada's own making.
And if people haven't seen, is it online now? Is it? Yeah, I got up at 6 a.m. last Thursday to watch this, and I was told by Monique that it was, it could be like watching paint dry, but it was like riveting. It was like these lawyers were revved up, the judges were revved up. So I'd encourage everyone to go and it's, how long is it? Like 6 hours, 4.5. I was there at 9 o'clock saying, wow, Landon, get out of bed, to my partner. Get out of bed. You got to come down and see this. These judges are all over, these lawyers. And anyways, it was not what I thought the Supreme Court was going to be like. And Joe, of course, was great in acting on behalf of the PHS. Our next speaker is Maxine Davis. Maxine is the executive director of the Dr. Peters Centre that houses Vancouver's other supervised injection site. The Dr. Peter Center's strategic thinking around supervised injection and their work with the nursing community has very much broadened the discussion and possibilities for seeing supervised injection as part of a continuum of health services for injection drug users. Welcome, Maxine Davis.
Thanks, Donald. It really was riveting. I didn't expect it to be so gripping either, and I would encourage you to go and look online for the court case. Last week, the Dr. Peter AIDS Foundation was at the Supreme Court of Canada as an intervener in the Insite case. It was an honor to be there and to contribute in some small way, hopefully, to a positive outcome. While the Supreme Court case was specifically about Insite, the outcome, I believe, will fundamentally shape the future of Canadian drug policy for years to come. It will address, are we going to continue to treat people who inject drugs as criminals, or are we going to provide appropriate health care? Supervised injection has become an area where law has not caught up with progress in public health. Supervised injection service has become mainstream thinking in healthcare, as evidenced by the interveners in the Supreme Court, the Canadian Medical Association, the Canadian Public Health Association, the Canadian Nurses Association, the Registered Nurses Association of Ontario, the BC Association of Registered Nurses, the BC Nurses Union. Do you see a pattern? Yay, nurses! and certainly Donald's comment that, and I'll get to it a bit later, that's certainly the crux of how the Dr. Peter AIDS Foundation started supervised injection service about 18 months before Insite opened. I was quite encouraged that all the judges were so openly and sometimes so blatantly critical of the federal government. And just to give you a quick sidebar on the two issues the judges were asked to rule on. Essentially, Portland Hotel Society and VANDU put forward that shutting down Insite was a breach of a person's security of person under Section 7 of the Charter. So it's a Charter of Rights and Freedoms issue. And the other was that Insite is a healthcare facility that is the domain of the provincial government and not one that the federal government has a right to tamper in. So that is the two things in question. So I'm not a lawyer who watches judges every day, and I'm looking forward to Monique commenting shortly. But from the level of sensitivity they expressed for the health impacts in their questioning, I can't imagine them not ruling in favor of Insite. So I'm going to go way out on a limb. Reminder, I'm not a lawyer. I think there's a good chance they will rule that it is a Section 7 security of person issue, and they'll provide specific directions to the federal government on how the jurisdictional issue is to be dealt with. So let's assume I'm right, so I can get on with laying out my vision of the future of Canadian drug policy as a result. If I'm not correct, it's over to Donald, and I'll leave him with the challenge of laying out that grim prospect in his new role. A ruling in favor of Insite will be a ruling in favor of health care and harm reduction. It will certainly open the door to supervised injection service in towns and cities throughout the country. Downtown Eastside residents who have access to Insite have a health and survival advantage which should be available to others in similar circumstances elsewhere in the country. It would only be fair. The Dr. Peter Centre has shown, from its experience over the past 9 years, that integrating supervised injection service is possible in a health clinic with a broad range of other healthcare services, and in a clinic providing care to people who use drugs and people who don't. Such an integrated approach to supervised injection would make the service more economical for smaller towns and cities where there are a smaller number of people injecting. It would also make it possible for Vancouver Coastal, for example, to provide the service in their community health clinics throughout Vancouver. Hopefully Vancouver Coastal is not going to come and wonk me on the head right now. Anyways, the Dr. Peters Centre has also built supervised injection into nursing practice in its 24-hour skilled nursing care residence. The service is provided in the residents' private suites. I can say unequivocally that such an approach in a residential care environment is an incredibly stabilizing feature. Individuals who needed 24-hour care but were chronically entrenched in street living finally had a home that accepted them. And there needs to be more 24-hour residential care homes integrating supervised injection service. So from our perspective, supervised injection is a practice, as in a nursing practice, not a specific place or room. Overall, the Dr. Peters Centre has stuck with a simple message, stating and restating supervision of injections is part of registered nursing practice. And Donald mentioned that we started this when we approached the College of Registered Nurses of British Columbia for a practice clarification, and they provided us with a written clarification that it was within the scope of registered nursing practice for a nurse to supervise injections for the purposes of preventing illness and promoting health. So a favorable Insite case would potentially open more doors than access to supervised injection, from my perspective. We know, for example, the harms associated with severely addicted individuals turning to organized crime to buy their drugs is quite a concern. A favorable Insite case would potentially open the door around this security of person issue to a case for access to prescription heroin as a health and security of person issue. And it would potentially open the door to a case for substitution therapy for cocaine and other stimulants as a health and security of person issue. I'm sure you could think of other examples where severely addicted individuals are put in harm's way to cope with their addiction. As I was preparing that last paragraph, a brain cell fired, thinking maybe we need to replace the term harm reduction with security of person. It is essentially what harm reduction is designed to achieve: security of person. It makes it easier to articulate the seriousness of the matter. We are actually talking nothing short of Charter of Rights and Freedoms, security of person issues. Finally, the federal government may look back and regret the day they took Insite to the Supreme Court of Canada. I am stunned by the number of Joe Blow mainstream citizens since I returned from Ottawa who have listened to the media coverage and can't believe the federal government would shut Insite down. I think if more and more citizens are getting their heads around the concept of a safe place to inject drugs, there is hope they will also get their heads around support for additional measures towards healthcare and security of person for people who use drugs. Then more politicians will follow, and then we will have transformed Canada's drug policy. Thank you.
What is it then? Since 56 protects from overbreadth, arbitrariness, and disproportionality in the face of evidence of the help you get to life, liberty, and security of the person in granting that exemption, why isn't it a violation of Section 7 not to grant that exemption?
Well, I'll say this much. I certainly agree with the premise that Section 56 may be regarded as a so-called safety valve, okay, so that Section 4 of the CDSA creates an offense And Section 56 gives flexibility. And that's the same reasoning that I think Justices Binney and LaBelle invoked in the Chaouli case with reference to the opting out, the ability to go to another province to obtain health care. And to say, well, you don't strike down the entire statute if there's a safety valve, this mechanism. And what Justices LaBelle and Binney said in Chaouli on that point is that you would address failures in respect of that safety valve at the implementational level. In other words, judicial review. Okay? And that's not what we have here. We don't have judicial review. The decision of the minister has not been made.
I just conclude, or before you conclude, ask you a concluding question on exactly that point.
Yes.
You've consistently said the minister hasn't made a decision. We have in the material the then minister's statement to the Standing Committee on Health on May 29, 2008. And it was a decision explaining why he was going to request the Minister of Justice to appeal Justice Pitfield's decision. It's very clear from all of those pages that he is not in favor of the supervised injection site and says so. In my opinion, supervised injection is not medicine. It doesn't heal accordingly, and he goes through all of the reasons he is not in favor of protecting Insite. Can we not, from a minister's comments to the Standing Committee on Health, conclude that a decision has been made not to extend?
Right. Well, my recollection of what was said in those committee statements is that the minister also said that he had a duty to consider the application when it was brought and to consider the material that was placed before him in reference to the application, and that he would do that. And he said he had to consider the public policy elements. So he's made that clear. That was, I guess, an expression of his concerns, but he made it clear, and I'll have the response in reply if I can dig it up. But he made it clear that he would consider the application as he had a duty to do, and he would examine the evidence that was presented, and that he would make a decision. And he also indicated that he'd consider the public policy. And so
the illicit drugs which are being injected as part of harm reduction at the supervised injection site are harmful to human health. There is no debate about this.
There's no question that injection drugs are harmful to human health. But my point is that the minister said, the then minister said, that he had a duty to consider the evidence and the material placed before him, and he would do that. And he also said he would consider the public policy.
But hasn't the court said on frequent occasions that it's not good enough to say, well, there's a discretion? I mean, if the rights are at issue here, don't we have to look at the situation and say, well, suppose the minister doesn't exercise his discretion? You're left with an absolute prohibition. Everything not permitted is prohibited.
Right.
And that's essentially a prohibition that we're talking about.
I think in my submission, if we look at Little Sisters and even what was said by certain members of the court in Chaouli, that a decision by a minister that's discretionary, that requires consideration of charter interests, it has to comport with charter values, and it's subject to judicial review on that basis. And it's reviewed at I think, what was referred to in Little Sisters as on the implementational level. And what I'm saying is that under administrative law, you would let that decision be made, and then you review it to see whether it comported with charter values. And that's what we have to say in response to that.
And I had no idea the judges would interrupt everybody and just jump all over them at times, some more than others. That was Paul Riley from the Public Prosecution of Canada office, acting on behalf of the federal government, obviously, and Judge Abella and Judge Binney talking to him. The next speaker we have, I find really difficult to introduce because he almost needs no introduction. His name is Dean Wilson. And it would take me too long to do justice to the path he has followed in helping to bring Insite to fruition. Suffice it to say that Dean has dedicated a huge part of his past 10, 15 years to this struggle and has been an incredible asset to this movement, and we thank him from the bottom of our hearts for his persistence, his creativity, stamina to get the job done. Dean Wilson.
Anybody want to buy a calendar? No. Anyways, I'm really happy and proud to be here today. It's been a long journey, and I'm going to sort of break it in two parts. I'm going to talk about Insite and my personal investment in Insite, and then at the end I'm going to talk about some of the observations from the trial, because I certainly learned a lot about it's kind of cool walking in there. It's such a hell of an institution. Our lawyers were absolutely brilliant, but I could just see how awestruck one could be. But first of all, I want to start out by saying addicts make bad decisions. That inherently infers that we have actually some options. Before anybody gets wired, there's definitely a period of time when they use drugs, whether they're using it as a coping mechanism, whatever. But if you need any intervention at that time, it's typically a long journey. They talk about treatment as this, let's have treatment instead of harm reduction. First of all, harm reduction is part of treatment. But treatment is a myth. There isn't any treatment out there. They don't want to fund it. It's this mythical thing where they say, oh, just go to treatment. Well, then you wait for 5 months to talk to some counselor who is making a lunch date with their other person they're getting on, and then the next time you go, it's a different person. You continually tell your story to these people, you get nowhere. So all of a sudden you're wired. You've tried, you're wired, and then what do they tell you? You have 3 decisions. What does getting drugs do? You're either going to end up in jail, you're going to end up in that house, or you're going to end up in a cemetery. These are really options that don't motivate people, let me tell you. So I think that what Insite brought to the neighborhood, and not only for the people that use it, but for anybody down there, was another option. It gave us hope that somebody actually cared enough to offer us health care in our own neighborhood, the nerve. Before that, we actually had health care by ambulance. People walked around sick until they literally fell down on the sidewalk, were picked up by an ambulance and driven up to St. Paul's Hospital. I just couldn't stand that anymore. I was politicized by VANDU. I'll never forget, the active users have to have a group no matter where they are. They've got to be part of the puzzle. I realized that it takes a great deal. I thought we were the only people who matters for the longest time. We were the ones dying. But a lot of people are needed from the very bottom all the way up to the top. One of the things about Insite is that mistaken is that they think it as an injection site. It is part of a comprehensive medical facility. On the first floor, we have an injection site. We also have peer and professional counseling. We have referral to that treatment out there. Then on the second floor, we have a detox that by design works. And also on the third floor, we have transitional housing. And the higher you get in that building, the better off you are. And as any addict knows, getting higher is something we can get our teeth into. So first of all, I want to talk about Insite by design. What does an addict need getting off drugs? First of all, it's about a 7 to 10 day. It's very uncomfortable. So let's not try to deny them cigarettes right off the bat. You know, most of us smoke. It's a very little thing, but you know, I've never been in a detox more than 25 hours before I got to Insite. Because I'm not quitting smoking. I'm quitting heroin and cocaine, okay, stupid? You know. But then, what else do I need? I need a toilet. And on the detox, on that second floor, they give you a bed and they give you your own toilet. I tell you the difference that makes. Because through those first 7 to 10 days, we're not changing behavior. We're not trying to get everybody's life in order. We're trying to successfully detox somebody as comfortably as possible. They have achieved that. And then on the third floor, if you manage to get detox, usually it's, oh, you're off drugs? Boot. See you later. Go back, live where you came from. And immediately you're right back drawn in. You can then go to the third floor and get into some rehabilitational transitional housing. And what's really cool about that is that one of the things, getting off drugs took me maybe a month. Getting over them took a good year. I was very depressed at about the second month. And they allowed me to pretty well just stay in bed. And I didn't have to go to a bunch of meetings and that, but they checked in on me and they made sure. And that week went by and I thought, you know, if they had to force me to do a bunch of shit, I would have just walked out. But they let me get through that part that I needed to get through on my own, that I had to force myself to make some of these decisions. And that's why my analogy for Insite is this, is that Insite/Onsite gives you enough rope, never lets you hang yourself, and actually teaches you that that rope is a tool to be used to climb out of the hole that you dug yourself into. It's brilliant. I want to thank anybody and everybody who has had anything to do with Insite, from the very beginning of talking about supervised injection sites to the people who work there, everybody, from the bottom of my heart and on behalf of 4,000 addicts in the downtown east side, thank you. Thank you. Now some observations on the Supreme Court of Canada. Wow, that was a blast. I walked in there the day before, and I was looking around. I was just awestruck. 5 stories of this beautiful Italian marble. 2 seats where the first 2 Chief Justices actually sat, and you're allowed to park your ass in there. I thought that was brilliant. And all of a sudden, this guy walks up and he goes, "Would you like a tour?" And I said, "No, I think maybe tomorrow." He goes, "Not tomorrow. There's going to be a big hullabaloo here. There's no tours tomorrow." Like, oh my God. And it was really interesting. I thought, wow, this is really important. We really are doing something. And then I was listening to the court, and it was really interesting because they were talking about back and forth, and all of a sudden the judges said, "Look, Parliament makes and changes law. What we do here, we etch in stone." A little bit different than just making or changing a law. And so it made me think about, first of all, well, we better be prepared for whatever result that comes down, whether it's bad or good. We will be prepared, I guarantee you. But that it is, what we're trying to do has to be etched in stone, first of all, because if we don't etch it in stone, people will come down later, especially with the government we have now, and will chip away. And as I say, it's not easy to chip away when it is written in stone. My second observation goes out, is a shout out to the nurses. The nurses I knew were always critical entry point into the system for the addicts on the street. I have a ton of compassion for you for that reason. But not only that, they are the critical entry point coming back downwards from not only the government through their regulations. I overheard 2 nurses talking about the regs, and all weekend long I studied those regs because I wanted to know exactly what they're talking about. And it really is, without those regulations, without those nurses, Insite never would have happened. And when that conversation you just saw, that judge was actually talking about, and it's a scheme that lawyers talk about. It's section 4 and 5 of the criminal code, and 56. 4 is possession, 5 is trafficking, and 56 is the exemption. And they talk about the scheme. And nurses are actually sort of the input and critical entry point on that criminal justice thing also, because they're the ones who were going to be charged in that, and the government. So, as I say, the nurses play an integral part, and they should have been just as much a plaintiff as an intervener. And the last thing I want to talk about was my observation is how important everybody's piece of the puzzle was. That I'm never going to forget that thousands of addicts paid for their lives, and that was the basis why this all came together. But that it took a lot of people who came together in a common cause to make Insite what it is today. And it will never be shut down as long as I'm on the block.
I think you can take that to the bank, that last statement. Thank you very much, Dean. I want to... When the lights come up, we'll see this wonderful bouquet of flowers that was given to us for this evening from Hola Flowers at Canby and Cordova, an ethically responsible florist. So thank you to Hola. Have the students been getting a workout running around with pencils and paper? Have people been putting up their hands? Where are you guys? Oh, there's someone's hand up there. Oh, you have a piece of paper in your hand. Have you got a question on it? That's very good. Okay, so it's working. The system is working. All right. Our next speaker is Dr. Will Small from the Center for Excellence in HIV/AIDS. Dr. Small is part of a very special team of researchers that have played a pivotal role in ensuring that the research done on the impacts of Insite on people's lives and the community was rigorous, peer-reviewed, and of the highest quality, knowing the kind of attack that some of their research would get. This has been a tremendous asset for our collective advocacy efforts for Insite. This was clearly seen in the remarks of the Supreme Court judges last week. Their knowledge of the research was impressive as they grilled the Justice Department lawyers. So, Will, it's all yours. Will has some slides.
Thank you. I'm very pleased to be here this evening, and I'm going to be speaking about the science and politics surrounding the evaluation of Insite. So hopefully this works here. Just to start off, give you a little bit of background, Insite had some very clear and simple objectives when it started. I think everybody's familiar with these, but the goal of the site was to reduce public disorder, reduce the risk for the transmission of infectious diseases, increase contact with health and social services amongst drug users, and reduce the risks associated with overdoses. But before the evaluation even got started or could produce any evidence, it was clear that it was going to take place in a highly politicized environment. This is a comment from John Walters, who's the White House Office of National Drug Control Policy Director, who called supervised injection sites nothing less than state-sponsored suicide. We have a different opinion from organizations that are in the business of preventing HIV and running public health programs. The WHO and the UNODC talk about safe injection sites in the following way. They say they are not a new intervention, but simply a packaging of existing recommendations. SIFs enable known WHO-recommended harm reduction interventions to be delivered and used in a safe environment with the aim to reach the most marginalized and most vulnerable of injection drug users. So the evaluation started in 2003. And has produced a large number of studies using a variety of methods looking at the different objectives of Insite, and has consistently produced findings showing that Insite is meeting its objectives. In addition to the individual studies that compose the evaluation, there's also a large number of commentaries, editorials authored by experts in the field of drug policy and addiction. As you can see from the titles of these, they're discussing the prolific amount of evidence produced through the evaluation and asking the question, just how much is enough? In addition, other commentators talked about the absurd politicization of the evaluation by the Canadian federal government, and some people even cast that as Canada adopting a US-style harm maximization approach. The local media has also been involved in the discussion and has perhaps misrepresented how much emphasis has been placed on harm reduction in comparison to treatment. It's something that Dean spoke about earlier. So harm reduction hasn't been the sole focus. There has been an increase in access to drug treatment over the same point in time. And this graph shows some data that we have showing increased rates of entry into methadone maintenance programs. There was also comments from the local health authority, Vancouver Coastal Health, showing that they've increased their annual expenditures on treatment in the period since Insite opened in 2003. So to speak a little bit more about the politics surrounding this, there's been some very powerful and high-profile lobby groups that have wanted to enter into the conversation or into the debate. The Drug Prevention Network of Canada is a very important organization in this regard. This is a quote from an interview with a representative from the Drug Prevention Network. And this person said, "Insite organizers flirt with the surreal when boasting about directing addicts into treatment. You cannot get involved with treatment with an addict who just shot up," said Berner. "You can't talk to someone who just shot up, so the claim that they make that they're getting people into treatment is absurd." These kind of comments persist despite scientific findings like this published in the New England Journal of Medicine, which shows that people that use Insite more often are in fact more likely to enter into detoxification treatment. So they're more likely to access detox services, people that are accessing and visiting Insite on a regular basis. This was another part of one of the studies that was published, and it shows a dramatic increase in the levels of access to drug treatment in the time since Insite had opened. And what it indicates is essentially a 30% increase in the number of people entering into detox services. This is another piece of the puzzle in the same direction. Not only are people entering into detox services and getting the residential treatment that Dean was speaking about, using Insite is also associated with actually stopping drugs. And it seems to me that this is an important piece of the puzzle because this is what the federal government is always on about. This is what they say that they want. So not only the Drug Prevention Network of Canada, but the Drug-Free America organization has also been involved in this conversation, has been an important lobby group. Their most important play in this whole story was this essay that appeared in this essay by Colin Mangham, who's the director of research for the Drug Prevention Network of Canada. And this appeared on their website, which poses as an online open access peer-reviewed journal. But in fact, it's really just a platform for the ideas and musings, writings of the Drug Prevention Network. So that last thing that I was showing you was some anti-Insite research. Thanks to the efforts of Pivot and a Freedom of Information request, it was discovered that the RCMP had actually supported some of these anti-Insite publications and reports. And this story recently appearing in Maclean's explained that the RCMP had commissioned these subsequent reports as a way to provide alternative analysis of existing CIF research, but they themselves recognized that these reports did not meet the conventional standards, academic standards of scholarship. So the evidence from the evaluation continues to flow in. This is a study that appeared in the Lancet, which is one of the top medical journals in the world, and it came out April of this year. And what this showed is that there was a 35% reduction in overdose deaths in the immediate vicinity of Insite, and this was based on actual coroner's records of actual deaths. So this is about as hard an outcome as you could get in a scientific study. So to give you an overview, it's been 8 years now since Insite opened and since the evaluation started. There's been 40 different peer-reviewed publications that have emerged from the evaluation, and obviously I can't go into depth to explain all of them, but I'll just give you a bit of an overview of the findings. So it documented a reduction in public disorder, and this was a number of different studies that documented this finding. There was also reductions in syringe sharing amongst Insite users. Insite has successfully managed thousands of overdoses. This is probably 3,000 or 4,000 overdoses. Liz could probably say more precisely. People that are using Insite have increased their use of detox programs and addiction treatment. Insite also allows women that are street-based injectors to avoid violence in the street-based drug scene. Users of Insite are more likely to use condoms, and Insite has averted many, many overdose deaths. And so those were the findings regarding the objectives. We've also looked at the other side of the equation to try and understand if there was adverse outcomes from the operation of Insite. There's been no adverse changes in community drug use patterns, no increases in the initiation of injection drug use, and no increases in drug-related crime. And that study was actually looking at VPD stats regarding break-ins and crime in the downtown East Side neighborhood. And you may not be aware of this, but now there have been 3 separate cost-effectiveness studies looking at Insite, and all 3 of those have determined that Insite is in fact cost-effective, more effective than spending money on other forms of intervention to address these issues. So all of these findings have led to numerous endorsements by a number of different organizations. This one is from the Health Officers Council of British Columbia. who resolved that they support inclusion of supervised injection services as an important component of comprehensive health authority prevention, treatment, and recovery substance-related services. So it's not only this group, there's many others that support Insite, the Canadian Medical Association, the nursing associations, as Maxine was saying, and a broad range of public health, nursing, and medical organizations throughout Canada. So in summary, the evidence is in. There's been a lot of evidence, and it's demonstrating that Insite is addressing meeting its objectives and not producing adverse outcomes. There's been widespread agreement amongst the international scientific community in relation to these findings. They've been published in peer-reviewed journals, and the commentaries and editorials from leading experts in the field also support that perspective. As I mentioned, Insite is supported by the major medical, nursing, and public health bodies throughout Canada. However, the science related to Insite remains politicized, as we've seen from the court case and as we heard from the stories this evening. I think to sum up, I would say that the evidence has prevailed, and the strongest indication of that was in the Supreme Court of Canada last week when the federal lawyers were asked point blank by one of the judges if they had any evidence that Insite does not work, and they were forced to answer that no, they did not. So I'd just like to briefly thank all the people who use drugs that have participated in the evaluation, everybody that works to reduce drug-related harm in the Vancouver area, and our community partners. And if you would like any more information about the evaluation or the scientific studies, it's available at our website at Urban Health Research Initiative, and that's the URL right there. Thank you very much.
And the end of that paragraph, they point out that since December of 2003, they've had this interim overdose policy, and based on their research and so on, they recognized that the occurrence of drug overdoses as medical emergencies, it showed that the incidence of drug overdose deaths can decrease if the police do not lay charges for the drug use. So the police themselves recognize that their enforcement activities can result in overdose deaths. We know that the unsafe practices are what caused the spreading of the disease. Those were the findings below, quite clearly, and unchallenged, I might add. The evidence of Wilson and Tomic was not challenged by the government, nor was this evidence. So you have frontline workers, the police, the others, the medical people who work with these addicts saying, their conduct, and when enforcement occurs, the reason why they do these unsafe things is because of the law, and in the result we have this public health crisis in the downtown east side of Vancouver. So the status quo is a public health crisis, and the enforcement of the law contributes and doesn't force addicts to do things, but causes them to act in these particular ways. And so you have the Section 7 violation that clearly is occurring in the downtown east side. And we do limit our submissions to persons who are addicted.
We have a couple more speakers, and then are the students collecting some of the questions? That would be great if they were. So we can get to them as quick as possible after the next two speakers. The next speaker is Dave Murray from VANDU, and John Conroy was acting for VANDU in that clip. Dave Murray is a member of VANDU, a member of the BC Yukon Drug War Survivors, and has become a strong voice for the Vancouver area network of drug users in their advocacy work to attain better health services for people who use drugs, and their continuing work to provide a critique of the actual impacts of the criminalization of drug users in society. Dave.
Wow. Hi. I went to Ottawa. I went to the Supreme Court of Canada. Yeah, wow, that was cool. And I wasn't in the prisoner's box, and And we were up against, well, I saw 9 big guys up there. I went in front of one judge once, but now there was 9 of them there. And anyway, John Conroy was great. He was VANDU's lawyer. And why did I go to Ottawa? Because nobody from VANDU was going. And I said, well, gee, John gave a spirited talk over at VANDU the Saturday before. And I just said, oh, I've got to see this. This is history. And I guess my other reason for going to Ottawa was I used Insite for a few years when they first opened. And I guess I could say quite positively that I might not be here today if I hadn't had that facility to use. I think Insite's a really important part of the downtown east side. It actually keeps people alive, so that one day, if they so decide to do, they can change their lives, move forward. And I think that's where it's so important to keep that kind of facility. And we could say, well, and I look at it every day, and I think a lot of people in the room that I work with would say, one Insite is not enough in the downtown east side. We're talking about, what, 5% of the people that use drugs in the downtown east side use Insite. And we talk about Insite being a safe injection site. Well, what about consumption sites? I think when Insite was originally designed, there was going to be they had designed into that facility a consumption site, so people that were addicted to crack cocaine could smoke crack and be safe. And I think that we need more Insites. And part of that was when I went to Ottawa, I met with some really remarkable people, Canadian Students for Sensible Drug Policy. And these guys have formed a committee today, and they're investigating how to do it, how we can keep opening safe consumption sites across Canada, no matter what the judgment of Insite is. I met with people. I went to Montreal after Ottawa, and I met with Cactus Montreal. I met with ADIC. I met with Metanam. I met with the groups in Montreal who had just come back from Quebec City, where they were talking about opening a site similar to Insite, supervised injection site. They've formed committees too now, and they're discussing whether to do it. And they're discussing whether they're going to wait or not, whether they're going to wait for the government to make this decision, which we've been told could take up to a year. So I think that we have to move forward on this, whether they're going to do it or not. A couple of weeks ago, I was in Regina. VANDU received a Kaiser Award, which is a prestigious award for excellence in programming from Edgar Kaiser and the Kaiser Foundation, and that was really something. But what really shook me on that trip was we went for a tour of Regina the next day, and we saw a lot of suffering there, really a lot of suffering there. And Regina, HIV/AIDS rates and hepatitis C, it's just rampant. A lot of injection drug use. A lot of cities in Canada, injection drug use is going down. Regina's going up. So Saskatoon too. Saskatchewan's really a hurting place. They could use an Insite tomorrow, and it would start to save lives the next day. Because that's what supervised injection sites do. They save lives. They keep people alive long enough so that we can, we got to look at everybody. They're all our brothers and sisters. They're our fathers and mothers, our sons and daughters, our cousins, our nieces, our nephews. These are the people that are hurting, and these are the people that we have to save. So we look at this. We went to the Supreme Court. The case should never have got to the Supreme Court. It should never even gone to court. This should be like a no-brainer. And I think I'm preaching to the converted here, because I know you guys wouldn't be in this room tonight if you were. I don't think you just decided, hey, there's nothing on TV tonight. I think so. We're not up against the Canucks tonight, are we? No. So it's a celebration in a sense because we got there. It'll be a celebration when we win. But I think that we have to realize there's still a lot to be done, really a lot to be done. I do work with some other people in the room. We do work on drug policy in Canada. We really have to really elevate the debate on this. And we have to bring it to our communities. We have to talk to our neighbors, our friends. We don't need everybody everybody's lives to be affected by these drug laws. We don't have to wait. We don't have to wait till your friend, your son, your daughter, your somebody in your family dies or goes to prison for these insane laws. You know, an addict is a hurting person. Is somebody that's really somebody we have to help. We have to do everything. We're a caring, loving society. We can't model ourselves after what they've done in the United States. We can't just imprison the problem away because it won't go away that way. And we're just going to, you know, like we've got a new government we got to deal with. But I look at that as an opportunity, and I think that's what we have to do. We have to elevate the debate. We have to talk about it. We have to talk about it with our neighbors. We have to talk about it with our friends. We have to do public forums like this where we actually talk to people, and we tell them like it is. And I think that's the way we're going to go. And the next few years it's going to be challenging, sure. And I think that we're going to do it, guys. You know, and I think with everybody's help in the room, that's it. We're going to do it. Thanks, guys.
Thank you very much, Dave. Our last speaker before we move to questions is Monique Pongracic-Speier. Monique, talk about no pressure, Monique. Just you and 9 Supreme Court judges looking down on you from it. It looked like they were like up here. Seemingly interrupting anyone who stood before them at will to ask all sorts of questions. Monique is a partner in the Ethos Law Group, and together with Joe Arve led the case for the PHS Community Services Society, Shelley Tomick and Dean Wilson, in the Supreme Court of Canada last week. So fresh from the big top in Ottawa, Monique, it's all yours.
Thanks very much, Donald. And thank you to everybody for coming out tonight. This is truly impressive to see such a large auditorium. And I thought what I'd do tonight in a fairly brief amount of time so that there are time for questions is just tell you a little bit about the story of Insite, the legal case. We know about Insite, the birth of the supervised injection site, and it was a long struggle, and it was a community struggle that brought things to the point where 3 levels of government actually agreed on something. And they agreed, in essence, that injecting drug use in this city should be dealt with as a health issue. Massive breakthrough. So after some difficulty getting to that point, the site opened, and it opened with an exemption from the Controlled Drugs and Substances Act. And that allowed injecting drug users to go into the site with their drugs and to inject under supervision. And they would not be subject to the criminal law while they were in the bounds of the site, insofar as their drug possession was concerned for the purpose of self-injection. And the staff at the site had protection from the trafficking provisions in the criminal code, inasmuch as they may need to handle drugs that are brought in by users. And the experiment, as we know from the science, worked very, very well from the point of health care and disease prevention and keeping people alive. And that's really what I think was so impressive about the site. And that's why it was so disappointing in the summer of 2006 that noises started to be made by the then, I guess, fairly recently elected Conservative government. They had been around for a while, but it was a Liberal government that had agreed to the exemption. And my clients came to me and they said, gee, we don't think this exemption is going to be extended. We think we're going to now be forced to take legal action. And so they were talking to me and they were talking to other lawyers, because I must say I am only one of a group of lawyers, phenomenal lawyers, who have participated in this case and made it possible. This has really been as much a community effort at the legal end of things as it was at the political and social activism end of things. So we started to talk in the summer of 2006. And we were making ready to file a court case. And unbeknownst to me, and I was probably pretty much alone in this, I didn't realize that VANDU was also talking to John Conroy, and good for them. And so John Conroy filed a VANDU case just before PHS was about to file its case, and then all of a sudden, with minutes ticking down on the clock until the exemption was going to expire, the federal government said, we'll extend it. And so we breathed a sigh of relief and we said, okay, we'll see what happens next. So we made our way around to the summer of 2007, and we're in exactly the same position. And it looks like the exemption's going to expire. But this time the noises are louder and more persistent. So our clients, and I must say I have the most wonderful clients in the world, gave us instructions to file the case. So we did. And so the PHS Community Services Society, along with two individuals, Dean Wilson, whom you've heard from tonight, and Shelley Tomic, both of whom tremendously courageous individuals for putting their story on the line, was their evidence about what their lives had been like, about how Insite had been in their lives. We filed our case with their evidence, and we ran around and we talked to the experts, and the folks at the Center for Excellence gave tremendous support. Experts from around the world also gave us support, much of it without expecting any fee whatsoever. They, it seems, had come to the conclusion that life was more important than anything else. And so again, there was this community coming together to file the case. And there was another extension granted to the exemption, but it only went to June 30th of 2008. And in early 2008, things were really looking like that was going to be it. There wasn't going to be another exemption. So off we went to trial. And we didn't know what was going to happen at trial. Mr. Justice Pitfield, who heard the trial, heard it on affidavit evidence. And the Government of Canada, to begin with, took the position that this shouldn't be just on paper. There should be witnesses heard. But the fact of the matter was, if we had gone to trial with witnesses, we wouldn't have gone to trial in 2008. It would have taken a lot longer. And then one day, I'm walking back from lunch after the trial is concluded with a friend of mine, and I run into Joe Arve on the street. And he said, "Have you heard?" And I said, "Have you heard what?" He said, "We won." I said, "What do you mean we won?" I didn't even know there was a decision. It had been suddenly released. And so that was great cause for celebration. And then the Government of Canada appealed, and there was kind of a collective groan. But we said, okay, well, if you're going to appeal, we're going to cross-appeal. Because as Maxine explained, there have been two issues in this case. One is about the right to life and security of the person under Section 7 of the Canadian Charter of Rights and Freedoms. The basic argument is that the law has stood in the way of health care, and that's unconstitutional. And then the other part of the case is that, look, this is health care. And health care under the rules of Canadian federalism is a provincial responsibility. In Government of Canada, you are inserting yourself where it is not your domain. So we had lost on trial on the federalism, won on the charter. So when the Government of Canada decided to appeal the charter, we decided that we'd cross-appeal on federalism. And we went to the Court of Appeal. And in due course, the Court of Appeal decided in our favor on both issues. And so the government then appealed to the Supreme Court of Canada, which is how I found myself last Thursday on my first date with the Supremes. I don't know if it'll be the last, but I must say I could not have been prouder to be representing my clients in that case, and to have that as my first opportunity to be able to argue in front of the court. The court was extremely engaged, all members of the court. Question asking at the Supreme Court of Canada is not uncommon. It's the rule instead of the exception. Although I must admit that the volume and the nature of the questions and the interjections surprised me even a little bit. And by the time this case made its way up to the Supreme Court of Canada last week, that community involvement that had been there right from the beginning had mushroomed into an incredible collection of interveners. There were, I think, 10 intervening groups, most of them intervening in support of supervised injection and in support of Insite and the Dr. Peter Center. And as you heard from Maxine, a very large number of them were healthcare-based organizations whose essential point, I think, as we went from one set of arguments or one set of submissions to the next was, this is healthcare. This is necessary, and if the law stands in the way of it, then that is unconstitutional. The court did reserve its decision. There was no surprise there. The one surprise that happened was the next morning when we then found out that we had either impressed or scared two of the judges so much that they were retiring. So that was a surprise. I think what it means for the case is that it is quite likely that the case is going to be decided, I'm going to venture to say, by the end of February 2012 at the latest, and the reasons for that relate to the rules around how judges can sign on to or write judgments after they retire. And the two judges that announced their retirements are scheduled to retire at the end of August. I think it is very likely that both of them will want to participate in this judgment. And I look forward to Insite being around. I look forward to other supervised consumption rooms opening, and I look forward, I hope, to the to our Canadian Supreme Court endorsing a law that is humane, endorsing a view of law that says evidence matters, and evidence really does matter, I think, in this particular case, and that endorses the view that the provinces in Canada have to be able to deal with healthcare issues in a way that is non-politicized. And so with some luck, we will hopefully get to that point. And in the meantime, this legal case is one small part in the bigger stream of drug policy. And looking down the road, the most important thing is not going to be this legal battle, or if there's another legal battle, that legal battle. The most important thing is community engagement and political engagement, because that's the way to prevent cases like this from getting to the court in the first place. So I guess the message I have to leave with you tonight is stay involved, get out there, and shape healthcare policy in a socially just manner. Thank you.
Thank you very much for those words, Monique. I just want to notice someone trying to get out of the room right now. Craig Jones is who provided some riveting and, I would add, very entertaining testimony at the Supreme Court hearing. So Craig was intervening, was representing the province of BC on the jurisdictional issue. So Craig, it's the Bowen Island ferry screwed up. So Craig's whole evening is a mess. But. Thank you very much for your hard work on this. I also have a mitt full of questions, so our system did work to some extent, and everyone, I went through them very quickly, and everyone is really good, and some are really hard. So I'm going to ask our panelists to come up and sit at the table here, and I'm going to lob your questions at them. And some are directly, most questions aren't to anyone in particular, but some are. So I'm going to try, and we'll get through as many as we can. We have about half an hour, I believe. I think we're supposed to be out of here at 9 o'clock. Can someone just test one of those microphones? See if they're working. Yeah, they're working.
That one.
So thank you very much to the students for collecting all these questions, and thank you very much for the questions that people wrote down. And I can read most of them. I'm having trouble with some of them, but I'm going to, because Monique is on a bit of a roll, there is one question that came for Monique. And the question is, to what extent do you think a victory for Insite at the Supreme Court opens the door for Brian Day's charter challenge to the BC Medicare Protection Act?
You weren't kidding when you said they were hard questions. I don't think this is on. Is this on? Oh, it is on. Okay. I don't know the answer to that.
She might have to do a bit of work.
Yeah, whoever asked that question, call me at my office.
Okay. We'll put her number up on the screen in a bit. This looks like it might be, I think I'll lob this one at Will first. Could you speak a bit about the financial cost effectiveness of the program?
Sure. Those cost effectiveness studies that I was referring to, they would have been a mathematical calculation of the cost of running Insite versus the cost of dealing with overdoses, with ambulance calls, prevented cases of HIV infection, which probably cost $300,000 over the course of someone's lifetime, as well as overdose fatalities, which we can't attach a dollar figure to. So I'm not really a math person, but that's what those things are based upon, and all three of them were consistent in finding that it was more effective to operate Insite than try and deal with those other outcomes that I just mentioned.
Here's a question, not directed at anyone, but you guys can figure out who will answer it. What percentage of people using the facility are casual users looking for a safe, sterile place to use drugs that don't have any want to use the detox portion of the program?
Well, first of all, I'm just going to jump in there on casual. I've never really heard that term talking about an addict to the downtown east side. I don't think there's such a thing as casual drug use down there. Most people, we're certainly not posers. We get out. This is not about getting high on the weekend down there. This is a serious issue. It's a health issue. You know, I used to shoot cocaine 50 times a day to cope. So I don't think that there's really casual comes into it. I think it's a misnomer. I think we have a lot of really sick people in the downtown east side that just happen to cope with their illness through self-medication, because as I said before, that treatment protocol is a bunch of bullshit. It takes forever to try to get in to see anybody. They won't invest in it. They just talk about it. So I just don't think there is a lot of it's not a party down there. Certainly not.
But are there people who I'll say are not hardcore, long-term, severely addicted people who use Insite?
There's a small percentage of people that use the site who may need assistance because they're not safe when they're using. And I think to differentiate, I wouldn't use the word casual either. I think the issue of addiction is never really casual, but I think some people use at different amounts and different rates and different drugs. And anybody that uses a site is actually demonstrating incredible responsibility for their behavior by choosing to learn how to inject safely, how to demonstrate responsibility for their use so that they don't spread infection. And so we really welcome that as a sort of a learning experience. So of course some people are reliant on the site for their ongoing use needs, and they come there for greater percentage of their injections than some people. But the research has shown that for everybody that uses the site, safer injecting practices are a result. So I think that that's really, really important to differentiate, because everybody has different use habits. So nobody uses the same amount every day and at the same rate. So somebody who uses it like once a week may not be using 20 times a day. And that's really important to understand. But beyond that, in terms of waiting to get into the detox, all I know is there is a steady flow of people requesting access to on-site, and I don't know how the staff figure out who to get in and when. But it's amazing to me that it works as well as it does, because it seems to me that there's always about 50 to 100 people juggling on some kind of a priority list that need to, and it works. And the staff are fantastic, and I'm very proud of all of the staff.
Exactly. Thank you. Here's one. If the feds win, will VCH, Vancouver Coastal Health, keep Insite open, citing the Dr. Peter Center model of not requesting a Section 56 exemption? Dr. Peter Center's open.
I don't know the answer to that, but I think that we're going to have to wait and see how the court rules. There are a lot of combinations and permutations to how the result could stack up with a bunch of different reasons. So obviously for Vancouver Coastal Health Authority, they're going to have to make that decision. They have been active in this case since the BC Court of Appeal. If that's a signal, I think it's a good one.
Maxine, do you want to? There's no one from Vancouver Coastal Health on the panel, so it's speculative, but it's a very good question.
Well, I guess my comment would be that from a Dr. Peter AIDS Foundation perspective, we're very firmly, clearly following provincial law. There is a Health Professions Act in this province. It authorizes and requires the College of Registered Nurses of British Columbia to set registered nursing practice. And furthermore, it says that an employer is responsible for a workplace that supports nurses, registered nurses in their practice. So the College of Psychiatric Nurses has also given us the same practice clarification. When we first got that practice clarification 9 years ago, when we went to our lawyers and asked for a legal opinion, they looked at it from a criminal prosecution perspective and from a civil prosecution perspective. And in a nutshell, they actually said to us that we were more at risk of civil liability if we didn't do it. Because if someone came into the Dr. Peter Center and the nurses refused to, if we as an employer refused to allow nurses to practice according to their standards, and someone took clean needles and went outside and injected and died of an overdose, someone could suggest in their personal world that we contributed to their death. So we'd certainly be in an, we did not seek a Section 56 exemption because we took the perspective we were doing everything reasonably possible to uphold federal law. The nurses do not touch the drug, like Insite. Nurses do not touch the drugs, they do not inject the drugs, and they do not provide the drugs. So if, we too would have, when this decision comes down, we too will have to look at the decision if it's not in favor of Insite and kind of determine what that judgment means for us. However, we'd be hard pressed to suddenly turn around and disobey the provincial law, so to speak. So, it's going to be an interesting moment in time if the feds don't support it.
I'd like to add to that just for one thing. If the Canadian government the Canadian Supreme Court decides that Insite shouldn't be there anymore and rules against, there's enough drug user activism will take over at that point, and we will have insights wherever, in apartment buildings, and it'll happen. And that's what was done before Insite was open, before there was an Insite. There was a very brave nurse at one time who set up a little thing on Carroll Street. Ann Livingston and Dave Dewar came along and paid the rent for this storefront. And this nurse, very brave nurse, her name was Megan Olson, and she just said, I believe in caring for my patients, and she went and did it, and she ran a supervised injection site, and she was there. She was dedicated to saving lives, and I think that's what'll happen. I mean, we'll see just civil disobedience in our community, because we know it works. We've got the 40 papers that Will's got. We've got the evidence, and we know we know we're right. We know we're fighting the good fight, and I just can't see that happening, but that's what would happen. I'm sure of it, and I know that would happen. I think, speaking for VANDU, I think VANDU would just open up the next day with all little school desks there, each little station for injections, and we would just do it. We would do it peer to peer. And I think that would be, nobody wants to see it come to that, but I mean, that's what the community would say. The drug user community, drug user activists would be right out there to do something like that.
I think it actually encompasses even more than just the drug users too. Like, I think this whole city of Vancouver came together through some good writers in the local papers, and just how we got educated the whole city. I think if we did open up and we were ruled against and we opened up, I think we'd have the whole city supporting us. And it wouldn't be just a downtown, he said. I think it would be a personal affront to the city of Vancouver if the federal government, because of all that the city invested in getting this done. And I'm telling you something, it invested just as much by soccer moms and everybody else out there who really had to put their mind to it, like, do we really care about those people? And the answer was, yes, we do. So I'd hate to see it not happen, but I think it would be a real affront to the whole people and everybody who works so hard in the whole city of Vancouver. And as Dave says, I'm sure the door will, I've got the key right here in my shoe.
I also don't think anybody at Insite would let it shut. So.
It wouldn't be pretty. I'm trying to.
Yeah.
Another question. Quoted from the Lancet Journal is the finding that overdose deaths around Insite have decreased by 35%. CBC News asked for clarification of that statistic today by stating that approximately only 5% of downtown Eastside drug users use Insite. Any answers?
Yeah, definitely. That's a good question, because it's a technical, nuanced point. And it isn't that only 5% of users in the neighborhood use Insite. That's a statistic that was lifted out of one of our papers, and what it actually referred to is probably 5 or 10% of the injections that occur in the downtown Eastside neighborhood are occurring within Insite, just because there's so many drug users and there's so much injecting going on. So it's far more than 5 or 10% of local users are using Insite. It's probably more like 40 or 60%. It was estimated to be 10,000 injection drug users in the downtown Eastside area, and Insite, to the best of my knowledge, has more than 8,000 or 9,000 registered users right now. So it's just a technical point. It's actually the number of injections, the coverage of the site, rather than the number of people using it that statistic referred to.
That's the only time I actually wanted to scream out at those judges and say, it's because we're already filled to capacity. That's the right. We're only doing 5%. Open another one, like we can say 10%. But it was one of those times where I just wanted to scream at those guys. But
probably a good thing you didn't.
Because I know there's so many other. But anyway,
as your lawyer, I'm grateful you didn't.
The Ottawa jail.
Yeah, exactly.
Some of the questions sort of stray off into other areas, so I'm sort of trying to focus on the Insite questions now before I get to some tougher, broader questions. If Insite is cost-effective, lessens the burden of health care dollars, what could be Harper's reason to be opposed to life and money-saving facility? Is it just an intense dislike of this group? How could that be a reason in court? And the second question, is it possible that more people seek treatment while using the clinic because it takes the craziness out of using? So the first one's about dislike of the group, Harper. I mean, you don't have to respond to these questions, but it's a good question.
Well, it's pretty crazy in that back room sometimes, so I don't know about taking the craziness out of it, but you always know that you're supported by a medical facility. And in fact, I thought in the beginning that people might actually use more than they should be because, I'm protected here. But we realized that it wasn't the case either. It was just another fallacy that they were throwing us. But somebody else want to comment on the first part there?
What would Harper say?
Yeah, I really don't know what to say about the first part of that.
I don't want to speak on my friend Stephen.
I think
we go way back.
It's largely ideological opposition to Insite and maybe in some ways a lack of sympathy and compassion for the people that are drug users on the part of the Harper government. But I don't know what to say beyond that.
You see editorials or articles written often by Daphne Brom or Margaret Wente, and the arguments that they use, which I think are kind of emblematic of Harper's government, tend to be based on this idea that it's misguided compassion. That term gets used a lot. They're naive in their simple analysis. They're enabling, all that kind of rhetoric around somehow if you make a drug addict's life easier, you're making drug use easier, therefore you're kind of deluding yourself to think that you're helping when the drugs themselves are the problem. But clearly the drugs are not the only problem, and I think it's complicated because even when you get into the whole argument around addiction as a disease, that's a complicated debate. I'm not sure that I really agree with that either. So I think the problem is everybody wants to package it up as a simple yes or no thing, like you're either pro-addiction or anti-addiction, and the pro-treatment side and the pro-enforcement side really oversimplify harm reduction as enabling, and I think that that's the most simplistic kind of summary of where I think Harper sits on the issue.
Yes, Bud.
Several years ago, I was on a panel at UBC with Gil Puter. In fact, that was, those of you who know him, that was his very last panel before he passed. And a conservative senator from Ottawa who was in favor of harm reduction. Don, you remembered his name, John?
Claude Nolan.
Nolan, that's right. It was Nolan. So it was the three of us and the UBC students. And one of the questions was, how much pressure does the United States put on Ottawa to not implement harm reduction and certainly injection sites? And Nolan, literally, he just immediately reacted and he said, immense, the pressure like that. And I think because we have so many battles in a way to fight here and certainly tasks to do to make the changes that are needed, that sometimes forget that pressure that's so hard coming from there, and it's so just wicked, actually. And when they call it a war on drugs, I mean, they're serious about the war on drugs. When they use that word, it's not just a simple poetic metaphor used. They have, so I think we really need to change it, get rid of Harper and the government somehow, and get somebody less in the pocket of the U.S., I would say, and certainly around this issue.
Thank you.
Dawn?
Yes.
I just want to make one other comment about that. Before the injection site opened, right around the election, when Larry Campbell was voted as mayor, we had a meeting that we were brought into at the U.S. Embassy. A colleague of mine, Dan Small, and I were invited. There was a small round table of about 10 people, and they brought up the U.S. Drug Czar's staff person, that John Walters guy, and we sat around a table where he lectured us for about 2 hours in a small room about the threat to Canadian sovereignty that the introduction of an injection site would bring to Canada. It was bizarre. We wrote pages of notes, and we just kept underlining the word sovereignty, border patrols. Like, it was very surreal.
In fact, Senator Nolan, I talked to his executive assistant, Ann, while I was out there, and Senator actually gave us a shout-out at the NATO conference in Germany on that Thursday. I was really happy about that. But he actually told me that the American government was willing to soften their stance on the softwood lumber tax if we would only not open Insite. You know, we're talking about billions and billions of dollars. Are these guys just complete assholes?
Those are frightening stories.
Yeah, they are.
You want more?
I don't know if we can take any more.
I mean, when they tried to open Naomi, which was a half a block away, a heroin-assisted treatment study, they went to Philip Owen, and they went over there in a big armored car, and they went in his office with guns, and they tried to intimidate him. And they went to Ottawa and said, you want trucks lined up at the border for hours and days if you don't cooperate. And we stood our ground on some of these things. You know, I mean, we don't want to copy the American model. We don't look south and say, hey, that's what we want to do. I mean, and I think that standing up to this kind of stuff, I mean, 95% of the funding that goes into drug research and studies and all this comes out of the American NIDA in the United States. Well, when we did that heroin-assisted treatment study just down the street, that was Canadian money. That was CIHR, Canadian Institute of Health Research, that paid for that, because the Americans wouldn't pay for that, because that's the kind of studies that they don't want to see work.
I know Monique will not have time to answer this question, but it was something that came up when you all go and watch the 4.5 hours of the Supreme Court case. You will hear a lot about this issue. The question is, can you help us understand interjurisdictional immunity and paramountcy, and how, when, if one trumps the other with reference to Insite?
Monique's the pro.
In a couple of minutes.
Canadian federalism in 45 seconds. So in Canada, we've got a division of powers between the federal government and the provincial government. Each set of powers is exclusive. In the law of Canadian federalism, there are several important doctrines that help you decide what to do when there is a conflict or a clash between the different levels of government. And over the span of, I guess, the last 130 years or so, two doctrines have had high points and low points. And the one that's had the most high points is paramountcy. It's the easiest one to understand. The idea is that when you've got a federal law and a provincial law that are in conflict with each other in one of two ways, either because one law, for example, says yes and the other one says no, or because the purpose of the provincial law undermines the purpose of the federal law, then under the rule of paramountcy, the federal law wins. So that's basically how paramountcy works. Interjurisdictional immunity, I wish they had a shorter tag for it, but essentially what that says is because each head of power, the federal powers and the provincial powers, are exclusive, the idea is that there's a core to each of those powers. And the one level of government should not be able to invade the core of the other level of government's powers. And so the argument that we made in this case is that the provincial power to deliver health care is in part defined by choice over treatment or providing for treatment and for making decisions about cost and efficiency within the healthcare system. And so because the court in the past has defined the power in that way, the argument goes, we think this is at its core. And so we argued that the doctrine of interjurisdictional immunity should apply to protect the core of the provincial power over the delivery of health care from invasion by the Controlled Drugs and Substances Act, where the nature of that invasion was so serious that it would essentially melt the core. So if the Controlled Drugs and Substances Act applies to Insite, it will undermine its very purpose. And that goes so deep into provincial powers that the argument goes Canadian federalism shouldn't accept it. So a few more than 45 seconds, but that's about the best I can do.
Wow. You've been practicing, I can tell, for several years now. Now, this is a very unfair question, but it's a question that lurks in the weeds in any of these public forums, and we have about 5 minutes left, and I have a few too many questions. But what would you like to see happen so that people don't have to turn to drugs in the first place? How can we help stop addiction?
Well, maybe we should...
It's a tough question.
Read Bruce Alexander about dislocation, and you're going to see that we're going to have a lot more problems with addiction rather than not a lot. And I think it has a lot to do with, as we move forward in this ever-changing and ever-speedy and fast world, that we lose connections to our family, to our roots, to our cultures, and the whole way the earth runs now. And I think we've got to sort of claw that back and take a little bit more ownership ourselves. But to prevent people from using drugs, my God, like how are we going to prevent people from drinking? How are we going to prevent, it's not a personal choice, but it's a tough, how are we going, what the question should be, how are we going to prevent people from being so entwined with drug use that there's negative behaviors? And I think we've got to look at that. I think people are going to use drugs, alcohol, tobacco, them all, but how do we actually become effective in preventing people from having negative outcomes when dealing with drugs or any other addiction? And I think that's what we've really got to focus on in the future, because there's going to be a lot more of us out there.
Or how do we make people's lives matter to themselves enough without the drugs being more important? And that speaks to the whole foundation of having a caring society. So national daycare programs, social housing programs, better welfare rates.
That's what I wanted to say. I guess the one additional thing, in addition to Liz's comments about building a social infrastructure that's more supportive of people, our experience at the Dr. Peters Center it demonstrates that there's a lot of, and we all know this, undiagnosed mental illness and undiagnosed depression and untreated pain. And it's interesting when you bring people into care, there's actually prescribed medication that will support individuals in those situations. And so their need to resort to illegal drugs actually reduces. So that's just one small thing that can be done if individuals had enough access to proper medical care.
Last question before we wrap up. If Insite wins, does this open the door for Vancouver Coastal Health to explore heroin prescription or cocaine substitution treatment?
Well, I think that's the bottom line that we've been looking forward. Dead people don't detox, so we've got to come up with a different plan.
Well, I don't know. If I'm going to speak to that, I would say hopefully, but I think that we got to get through this heroin-assisted treatment as a program. We got to get to that point. I think that the research that was done right here in Vancouver with Naomi is very valid throughout the world. There's been heroin-assisted treatment studies done in Spain and Germany and the Netherlands and Britain and many countries in the world, Switzerland, and they've all shown that heroin-assisted treatment as a program would work for certain people, Right now, in British Columbia, all we offer people when they're coming off, when they tell you they don't want to do heroin anymore, is we offer them methadone, one drug. There's no choices involved. It's methadone or abstinence, and a lot of people aren't ready for the abstinence part. I think that we have to get past studies, and we have to start looking at the evidence, and the evidence shows that the heroin-assisted treatment works. I'm going to give you an example of Denmark right now. In Denmark, since last February, they're in 6 cities in Denmark. There's heroin-assisted treatment programs where people go through every day to get their heroin injection, and the evidence that they relied on, why it's not a study there, and they didn't do a study in Denmark. They relied on the evidence that came right from here from Vancouver. You know, where people that were in that program, all their health indicators went up, everybody gained weight. I mean, all the underlying issues were changed. I mean, the study was a success, and here we're going to be doing another study right here in Vancouver. It's called Salome, which should start quite soon. This time it'll be 322 people from this downtown East Side community that will be in this program. And I think that we got to get past the study part and start putting these things into programs, because that's what they're doing around the world. I think we have to look around the world and see what some of the things that are working. And they looked to us and they said, wow, that was really cool what you guys did at, right here at Abbott and Hastings. And I think that the heroin-assisted treatment is something that we have to really consider as a program.
I would just add to what Dave said there, and I think it is really important to move beyond the studies and beyond the pilot situation, and I think that's one of the very unfortunate effects of the political climate surrounding these types of interventions. So if we're finding that they're effective and they're meeting objectives, not causing harm, they should be scaled up, and that's really one of the things that may result from the court case.
Monique?
It's been my understanding that human beings have always used substances to alter perception for all kinds of reasons. So the outcome of those substances and the effects on the human beings and on the communities in which they live and use these substances is a structural one that needs to be changed. And if there are problems, which we certainly have created a lot of problems, or the problems have been created for vested interests and other reasons. So I don't know that we would ever, it's a matter of eliminating use so much as changing the way our society operates and governs itself. So.
Monique, do you have any legal comment on that? Will it open the door for heroin prescription programs?
I'm going to give you the typical lawyer's answer, which is maybe. And I'm sorry I have to give you that answer, but a lot's going to depend on how the court decides the case. So if we assume a good outcome, there are lots of different ways that the court can get to that outcome. And certainly some of the questions that we got from the bench were directed at how do we put a fence around this thing, or how do we limit this thing? And I think for the most part that's where the questions came from. As the members of the court continue their deliberations, I wonder if some of them will start to ask themselves, should we be trying to limit this thing? And so we'll have to see what they decide. But I think that a positive outcome to the case will have some kind of impact, either direct in a legal sense or indirect in terms of supporting compassionate and humane policy. So I think this is going to be a step down that road.
Okay, great. I really appreciate and thanks to all the panelists, Monique, Liz, Dean, Will, Dave, Maxine, and Bud. It's not over yet. One more thing to do. There's not many communities you could have, and we could have had 8 more panelists up here who are well versed in all this sort of stuff. There's not many communities that have such a rich array of resources to draw upon. So hopefully we can grow this movement across the country. While we have been in this room, there have been little pivot elves putting together an email. The Harper government has pledged, Harper government, his phrase, not mine, has pledged within 100 days of forming a majority government, he will introduce sweeping omnibus crime bill that will bundle all of the Conservatives' previous anti-crime initiatives into a single piece of legislation. Much of this legislation will have serious negative impacts on people living with addictions and in need of health services like Insite, supportive housing, and other medical services that most Canadians have access. So at 9:30 tonight, you're all going to get an email. We have a lot of your addresses. If you want us to have your address, there will be people outside who will take your address. You're going to get an email that's going to ask you to send a letter that's already written. You can write your own. You can change this one, but it's an outline of a letter to the federal leaders in Ottawa, asking them to really think seriously about evidence-based policy and where this omnibus crime legislation is going to take us and what path it's going to take us down in terms of harm, cost, and ineffective methods of punishing people who have health problems. So it's up to you guys to receive the email and do what you wish with it, but we wanted to have a little bit of action come out of this, this forum. Sorry? And forward it to your friends and family and brothers and sisters. And so thank you for the questions. I'm sorry there was about 6 questions I didn't get to, but we really want to be out here by 9 o'clock. We're 3 minutes over time. Thank you for the questions, and thank you all for coming.